More than half of known infectious diseases are zoonotic, meaning they pass between humans and animals, and an estimated 3/4 of emerging infectious diseases come from animals. How does a child playing near a tree with bat droppings turn into an epidemic of Ebola virus disease? How does leaving food uncovered in a household with rats become an outbreak of Lassa fever? We know that human behaviors at the interface between humans, animals, and the environment influence whether exposures turn into cases, cases turn into outbreaks, or outbreaks turn into epidemics. But how do we know what factors are influencing those critical behaviors so we can prevent and stop epidemics? Hello, I'm Natalie Tibbles. I work in the Research and Evaluation Division at Johns Hopkins Center for Communication Programs. Today I want to introduce a web-based toolkit, ZBRA, which Breakthrough Action launched in March of 2023, and walk through a couple examples of its use. I will briefly introduce ZBRA's components and purpose to provide context for the use cases, but to set the stage for our discussion, I want to take the first few minutes for a brief reflection. This is ZBRA's homepage. These two statements really form the thesis of the project. Human behavior drives epidemics and can stop them. And behavioral research helps us prevent, detect, and respond to zoonotic diseases, many of which have epidemic potential, in the context of a One Health approach. Let's take just 1 minute to reflect on what factors influence whether a person adopts a healthy behavior or maintains risk behaviors in the face of a potential or ongoing outbreak. For the purposes of our reflection, we can narrow it to the example of someone choosing to wear a mask during a respiratory virus outbreak. With just a quick reflection, probably including our own personal experiences, we are reminded that the factors that influence behavior, known as the determinants of behaviors, interact in complex ways, vary by place, and change over time. In our example of mask wearing during a respiratory virus outbreak, we can see that there are a lot of determinants. Do people know that masks protect them? Do they know the difference between a high-quality and a low-quality mask? Do they feel the virus is a serious threat? Do they personally feel that the virus could infect them or that it would be serious if they got the disease? Do they have the money to buy masks? Do they believe masks work? Do they trust the public health authorities who are promoting them? Are there supportive norms around mask wearing, or do people stigmatize those who wear masks, such as have masks become a political symbol? Do people simply forget to wear them in public unless there are constant reminders? I'm sure you are resonating with these questions as you think about the recent battles over mask wearing for COVID-19. Even in one pandemic, in a certain phase, there was intense demand for masks, so much that people considered it their civic duty to donate time and fabric. In certain places, masks were never much in demand. Later in the pandemic, at least in some places, masks became almost a visible statement of your political beliefs. So there's a lot of complexity when it comes to what determines behavior, and these are not universal and they are not static. They vary by place and they change over time. Identifying and examining the factors that influence multiple behaviors at the animal, human, and environmental interface is particularly complex. Several factors make it challenging to collect this type of data or even know where to start. There are a wide variety of possible behaviors that can lead to a zoonotic event where a pathogen passes from an animal to a human, or an outbreak where the disease begins spreading between people. There's really not the consensus there is for health areas like malaria or HIV around what are the key behaviors. Second, certain behaviors relate to one disease, whereas other behaviors intersect with multiple diseases. And the amount of research, kind of on the determinants of the behaviors that lead to these diseases varies. There's been considerable research in Africa and Asia in the last 10 years on certain zoonotic diseases, such as rabies or Ebola virus, whereas other diseases remain understudied from a behavioral perspective. And there are also new pathogens that haven't even emerged yet. There are many kind of influential populations that are important to consider. Certain behaviors are relevant really to the general population, whereas others are typically only practiced by individuals who work closely with animals. And finally, the disease risk and the relevance of certain behaviors is constantly changing. So the phase of an outbreak, whether it's to prevent an outbreak or prevent a zoonotic event, or during an outbreak period, or kind of in the recovery period, the timing of data collection and the relevance of the kind of key behavioral determinants will vary. We desperately need this type of information so that risk communication is strategic and resonates with people. Without data, health authorities are reacting and scrambling rather than communicating proactively into the information gaps and speaking to the real concerns and populations of the population. ZBRA attempts to begin closing some of these gaps. As we started working in the global health security space in late 2017, early 2018, and in each subsequent response, we have found ourselves needing behavioral data. And all of our expertise in breakthrough action, in risk communication, and social and behavior change interventions, all of the collaborative learning we have done on global health security teams over the last several years, we are bringing that to bear here to help people do this research better and better as each emergency looms or occurs, standardizing and making readily available information on how to explore behavioral determinants of zoonotic disease in localized and dynamic contexts. So now let's briefly look at the different components of ZBRA that help users do this before we jump into some use cases. ZBRA has 4 primary components that we'll look at briefly. First, we offer basic profiles of selected zoonotic diseases, what people call priority zoonotic diseases, and selected behaviors associated with those diseases. We offer research tools that people can download. By tools, I mean actual guides, questionnaires that explore behaviors through a behavioral theory lens. We summarize some cross-cutting findings and post reports that the project has developed looking at zoonotic diseases. And then each global health security project with Breakthrough Action has a page that summarizes the One Health landscape and behavioral research we've conducted and how we've used it. These components work together and can also be used or referenced individually depending on the user's needs. We started from 14 priority zoonotic diseases and identified a list of standard behaviors that had been explored through Breakthrough Action research. So these disease profiles serve as a quick reference and kind of minimizes searching for basic info on diseases of interest. So it pulls out some key points and then links to reliable information about that disease on, for example, WHO websites. And this table you can filter for different characteristics of diseases that you're looking for and then download as needed. This page summarizes behaviors that are tagged by disease, and kind of a lot of effort went into choosing which behaviors link to which disease based on their modes of transmission, their origin, etc., and then giving a brief description of the behavior and some different characteristics that you can filter. So it helps to highlight associated behaviors for diseases of interest, and it indicates what other diseases the behavior might be relevant to. We also offer some resources for prioritizing behaviors because you may have a variety of behaviors, but some are more important to emphasize given the stage of the outbreak or the local context or other circumstances. So we offer some considerations for how to select and prioritize behaviors from your list. On the data collection page, we give some sort of overview on how to think about a research question and define your methodology and your population and study sites. But then we gathered qualitative and quantitative research tools, so questionnaires and guides that people in our organization and in the literature have used to explore behavioral factors that influence zoonotic disease outbreaks or transmission. And we tagged each question by disease to the best of our ability. So this allows the user to filter the table by the approach they want to take, whether it's qualitative with IDIs, in-depth interviews, or through focus group discussions, or through a survey, quantitative kind of survey questionnaire, the population that they're working with, where they're collecting data, and the disease or diseases that they want to look at. And then you can download a customized questionnaire based on the criteria that you give it with some tested questions relating to the disease of interest. As far as this third component, the summary findings, we've started to compile a few cross-cutting themes based on some sort of baseline formative qualitative studies that we did on risk and prevention behaviors, beliefs, attitudes related to zoonotic diseases that were used in several countries. And then we've also uploaded all of our current existing research reports from various studies on zoonotic diseases throughout breakthrough action, and we're continuing to analyze and kind of pull out those cross-cutting themes. Finally, we have country pages that our teams and One Health groups can use as a launching point for behavioral data and for summarizing the One Health landscape in each country. So this serves as a supplemental kind of country-level repository for behavioral research and other One Health-related information, tools, and resources. So let's look at how these different components could be used. We developed this resource considering several profiles of potential end users. So one is a research team that wants to understand behavioral drivers that could prevent spillover events, of pathogens that can pass between humans and animals. So this team wants to rapidly explore the behaviors and determinants of behaviors and is familiar with social behavior change and behavioral research, but perhaps inexperienced with zoonotic diseases. So doesn't really know what are the key behaviors for the diseases that I'm trying to study. Second would be a public health practitioner who is looking to design community engagement or risk communication or mass media interventions to address and improve individual and community level behaviors to prevent priority zoonotic disease cases and outbreaks. So for example, you might think of a country where there hasn't been this qualitative formative research done, and they want to read reports and kind of understand and leverage what data have been collected in similar settings. And then third, maybe someone working in the government who's contributing to a strategic communication plan for addressing priority zoonotic diseases, or a strategic plan in general that has a communication component. So there is this tendency to prioritize clinical or biomedical approaches, but for someone who has an openness to thinking about outbreaks from a behavioral angle, the resource is meant to help understand high-level cross-cutting topics, make reports available to guide advocacy and investments in preventing priority zoonotic disease outbreaks. The first case study involves avian influenza. Imagine that H5N1 is circulating in wild poultry and in a variety of other wild and domestic animals, and there are individual cases or small clusters that keep popping up, and you're a government outbreak response team in a global health security country. You're reading about birds in Montana, a child in Cambodia, dolphins, and you're anticipating a problem. The disease seems severe. Right now it's limited, at least for the moment. You may remember the WHO pandemic phases. So there's a phase for exactly where we are in our scenario. Phase 2, an animal influenza virus is circulating and has infected humans in a few cases. Even though the risk to humans is currently seen as low, a mutation in the disease, in the virus, could elevate the risk, and the increasing number of infections in different mammals is something to watch. The 1918 flu pandemic, for example, had an avian origin. So what are the recommendations for Phase 2? First, revise the national preparedness and response plans, develop cross-sectoral surveillance systems, complete communications planning and begin communication activities, promote beneficial behaviors in individuals for self-protection, and plan for use of treatments and vaccines. So back to you, our outbreak response team member. You have two goals in light of the situation. You want to prevent people from exposing themselves to avian influenza from animals, either wild or domestic poultry or any of the mammals who have been affected from those birds. Second, you want to anticipate and start preparing for a mutation in the virus that would make it more transmissible between humans. This will allow you to develop and pre-test communication materials that can be deployed quickly to support 717 targets in the event of a sustained human outbreak. For the first goal, you want to do some behavioral surveillance on the human-poultry interface in certain high-risk areas of your country. Are people taking precautions to avoid exposing themselves to H5N1? Why or why not? Is the Phase 2 messaging we're putting out reaching people and motivating them? Where to start with this exercise? If I go to Google and search how to prevent people from catching avian influenza from an animal, I get 2.6 million results. CDC, WHO, and USDA have simple information about protecting yourself as an individual, but it takes quite a bit of searching and reading to get to a clear list of behaviors. If I go to Embase or other, other software that looks at the peer-reviewed literature to look for questionnaires. There are 6,714 papers about preventing avian influenza. If I look for existing survey data, it's still over 500 papers that are mostly irrelevant or dissimilar from the setting I'm responsible for. So this is really the first challenge we're trying to address. Streamline the process of identifying the key behaviors that protect people or that create risks, and rapidly collecting systematic data. The behaviors table allows you to consider your own scenario. Are you concerned about animal to human spillover or human to human transmission? Are you looking at a particular disease? You choose the filters you want in order to download a customized list of behaviors. Then there are some recommendations about prioritizing those behaviors. So here I've just chosen avian influenza. For my first objective, which is to understand people's interactions with poultry, I'll filter it further to look only at animal-human. But I can also focus on human-to-human. The list of behaviors is key to ensuring your communication strategy is comprehensively addressing what people are concerned about and what they are doing. We know from health behavior change theories that simply hammering away at the danger and the threat of the disease will put people into fear mode and paralyze them. If you have specific behaviors you want them to avoid and other precautions you want them to take, and the behaviors are consistently and clearly described, and the factors that are motivational to people in your setting at this time are leveraged, people can move from the paralysis that comes from helpless fear or confusion into a mindset of being motivated to take action. From there, you can move on to the page on collecting data. On this page, you can review some key considerations on designing your approach. You know that for this current threat of animal spillover of H5N1, you want a quantitative questionnaire that looks at interactions with animals among the general population. So the whole output of this page is a customized questionnaire for your diseases and your population and methodology of interest. So you just select the things you want and download your questionnaire and adapt it as you need. Okay, so you have your short survey questionnaire that you're going to field rapidly in high-risk areas or hotspots where there's substantial interaction with wild or domestic poultry, just to track behaviors around that interface. But now, in anticipation of human-to-human transmission and a larger outbreak or epidemic, you want to go a little deeper with why people do what they do at that interface, as well as how people perceive protective measures or for person-to-person transmission or care seeking for influenza symptoms, for example. From here, I'm filtering using the same table for qualitative focus groups approach with the general population, looking at avian influenza, and then I download my questionnaire, my guide for those focus group discussions that digs into some of those factors. And from here, I'm getting ahead of a potential major outbreak or epidemic by collecting and analyzing the data and starting to prepare risk communication, community engagement materials, mass media materials, etc. In our second scenario, we're looking at an outbreak or a potential outbreak of Lassa fever. Imagine in this scenario, you are a researcher in a country focusing on Lassa fever. As you know, Lassa fever is endemic in West Africa and is spread by a specific type of rat, although usually through their urine or feces contaminating food or household products. It also spreads person to person through close contact like blood or fluids, so it can be a problem spreading in health facilities. So for you as a researcher in this setting where there might be small outbreaks in progress, you know you need some quick intervention right now to help people protect themselves. And you're also working kind of on a longer term plan to revise the National Communication Plan for Lassa for the next 5 years. The SITREP is saying the current largest outbreak is mainly propagating through health facilities, so you want to understand the perspective of healthcare providers, both on what's happening in the facilities as well as their view on community perceptions. So you want to do some rapid individual interviews with health providers. So here on the collecting data page, you're going to filter for qualitative research, IDIs, select human health provider, and then select Lassa fever. This is going to produce a questionnaire for you that's focused on behaviors related to Lassa fever and geared for health providers. Again, you click download your questionnaire, and then you can adapt it as needed. We talked about the fact that in this scenario, you don't have resources or time for an in-depth community study, but you're interested if there's more out there on household-level behavioral determinants of Lassa. So you can check this page and see if Breakthrough Action, or hopefully as we go on, other partners, have done this type of research that may not be found in a traditional literature review. So sure enough, as I am filtering the table for Lassa fever, and I'm looking for reports, any reports that are in English, there are several reports that come up. A desk review, a literature review, a baseline study, and a qualitative study. So, since in this scenario I'm interested in what's known in West Africa in terms of in-depth factors that might help shape my communication strategy, I'm going to look at this study at Sierra Leone. So I'm clicking on the link and opening the report. This has really been a brief overview of this resource, ZBRA, and we have some things that we're working on to complement and expand the resource. We're currently adding additional country profile pages for new breakthrough action global health security countries. We're updating the profile pages, adding our research reports, adding case studies on how people are using behavioral research, and linking where possible to relevant research done by partners, implementing partners, or others in each country. We're refining the research tools, we're refining the interface based on user feedback, and we're continuing to kind of pull out the themes that seem to cut across different studies. We would also love to leverage the work that we've already done with ZBRA and use it as a platform to host a dashboard for a kind of proposed large-scale quantitative zoonotic behavioral survey. So a survey looking at some of the things we've been discussing, but on a larger scale, more representative, done in more places, and kind of create a dashboard to have this data for action readily available to people in a localized and appealing way. And we also want to continue to improve the functionality to use it as a repository for One Health and zoonotic disease-related communication materials. I'm really grateful for your time today, and my contact information is there if you have any feedback or questions. Thank you.